Good evening, everyone. Nurses represent a large group of the Asian Indian population in the United States. Indian nurses have been providing exceptional patient care for more than 5 decades in the US. We have heard many officials of different countries praising the dedication of Indian nurses during this pandemic. In North America, up until now, there are no reliable source of data on the total number of Asian Indian nurses or any demographics on this group of nurses. As a result, our contribution to US healthcare, especially in the context of healthcare crises such as current pandemic, goes unnoticed. In an effort to systematically obtain demographic information on all nurses of Indian origin and heritage, National Association of Indian Nurses of America, which is NINA, a professional national organization for Asian Indian nurses in the United States, is conducting a survey of all licensed Indian nurses who are working and retired in the USA. Today, we have the members of the survey task force in this meeting going to answer many questions related to this survey. So let me introduce the panel to all of our audience. Ms. Agnes Teradi, President of National Association of Indian Nurses of America. Member Advisory Board, Sarah Gabriel of NINA. Secretary of NINA, Leda Joseph. Chairperson of Membership Committee, Haridas Tangappan. Chairperson of Communications Committee, Suja Thomas. And Chairperson of Election Committee, Mary Phillip. I welcome you all to this panel discussion. Now let me welcome NINA's President, Dr. Agnes Teradi, to welcome our attendees.
Good evening and welcome everyone. We so appreciate you taking the time to come and join us. As Simi mentioned, this is to talk about the survey and what's in it for you. We would welcome your questions regardless of whether we can answer it or not. We want to hear from you, and we want you to be able to go back with the information that will help you to confidently take the survey. So the manner in which our webinar will be conducted is we have both our moderators, Simi Jester and Suja Thomas, who will be moderating the questions. They have questions that have already been received by this task force during the past 10 to 15 days. And they would also and you would give us more questions. We'll happily answer all of them. Over to you, Suja and Simi.
Thank you, Agnes. As we fight the coronavirus pandemic, we would like to take a moment to remember our fallen heroes in this battle and recognize the frontline workers, healthcare workers, for their courage and sacrifice. Let us take a few minutes to bow our head down and pray for the departed souls. Thank you. May God bless you all. Simi, you may start.
So when we opened the survey, many questions came up about the survey. That's the main reason we are having this panel discussion. Some of the questions we received is already here. My first question goes to the panel is, what is the purpose of this Asian Indian Nurses Survey?
I can answer that question, Simi. Simply put, the purpose of the survey is to just gather information. And this is a general information that we are collecting from all Indian nurses. The main purpose is to really know how many what are our strength in number in the United States. This includes active nurses who are in the workforce working right now, as well as the retired nurses in this country. To identify and to also the impact that we are making. We are as a community has so much offer, and we had been doing that, but we don't have anything collectively to say our strength or the impact we are making in American professional nursing arena, as well as in the healthcare industry.
Thank you, Sarah. That's a great answer. The next question that we have received is, can you please explain the specific goals of the survey and who do you think should complete this survey?
I'm happy to take that question. So I'm going to follow up to what Sarah just mentioned. Sarah talked about the purpose. The purpose, of course, is to get the exact numbers. But the goal is basically to look at the Asian Indian nurses. Now, we know that Asian Indians are the fastest growing minority in the country, in the US. And when it comes to the professional group of nurses, I think we are one of the biggest group in the sub-ethnic minority of all Asians. So the goal is to see if we can gain for the Asian Indian nurses their rightful place in the section as a distinct ethnic minority and not get put together in the group of Asian nurses. I hope I've answered your question.
Thank you, Agnes.
welcome.
Another question is, it's a very common question will come up when people do these kind of surveys. Does the United States already know the number of Indian nurses so far?
I think I can answer that question. In the US, they have the number of Asian nurses, but not specifically Asian Indian nurses. Although we provide them with our ethnicity when we apply for the license, they put everyone together as Asian nurses, but not Asian Indian nurses. So right now we are trying to find out the total number of Indian nurses in the United States. Hope I answered your question.
Thank you, Mary. That's excellent. The next question that we received is for the panel. What is the benefit to Indian community with this survey?
I'm happy to take that question, and feel free, the rest of the panelists, to add in what you see as the benefits. I would like to put it as there are 4 benefits to us doing this survey, which will target the Indian community, not just the nurses, but the general Indian community. First is, if we find out how many LPNs, RNs, APRNs, or as we typically address them as nurse practitioners, living in each county or city or state, we will be able to get that through the survey, as long as all our nurses participate. So our plea is, everyone please participate. The second advantage or the benefit is knowing where these specialized resources are in the community. When I say resources, the expert nurses or the expert advanced practice providers, knowing where these people are, it will help us to plan and provide targeted, culturally and linguistically appropriate care for our population, because we know that healthcare given to the diverse population by the community or by the providers of that community has got sustainable impact, and it will improve the health of the community. So that's the second benefit. The third one is it would help us to conduct research, and maybe on the health and well-being of Asian Indians, if we know the competency and the skill of advanced practice nurses to be able to do the research and join with the other providers in the same community. And the last one is, we are not here for the health of the community for 10 years. We are talking about future. So to invest in preventive care for high-risk illnesses in the Asian Indian communities, we can do that with the help of advanced practice providers and providers, provided we know them where they are. I think these are, in my opinion, the benefits.
Thank you, Agnes. That was excellent answer, which we know, a lot of Indian nurses are on top of higher education, and many of the APNs around Indian community are providing a lot of services to the Indian population, which a lot of our grandpas and grandmas will benefit by getting an APN as the provider, as an Indian. The next question which we have received is, I have experienced outside US nursing workforce. Is that considered in the survey?
I think I can answer that question. Yes, experience is great. Experience makes us skilled nurses and advanced practice nurses. Experience from different countries, they count as well. However, this survey, we are quantifying the number of nursing years we are providing as an ethnic group to the healthcare system in the United States. So while it is commendable to have experience outside the United States, please put the nursing experience or number of nursing years in the United States for the sake of the survey. I think that answers the question.
Thank you, Lata. That was an excellent answer. The next question that we have received is, we have a lot of baby boomers that are retiring, and we have not seen a lot of retired nurses have taken this survey. What do you think is preventing them from taking this survey?
I'm a retired nurse, so I can answer that. The retired nurses are nurses who really came in the United States as pioneers, or the workforce started in 1970 onwards. So most of them, or a lot of them, have retired, and they are not, a lot of them are not very active with the computers now. And so I had been calling everybody who I know, and then the references, to tell them about the survey and tell them to fill the survey. So few questions I got from them I want to share with you. Is very eye-opening for me also. So one of them asked me, why did it take so long for you to do this? You know, why didn't you do this when I was working? You know, so she felt neglected, or her work didn't count. So the second one was like, one of them asked me, I really don't want to fill the survey. What are you going to do with this numbers you get? So it is like, when I started asking her further, the question, the fear I heard from her voice was, if we have a list like this, she's afraid that somebody or other is going to ask the list from us, and they will be asked to join the workforce back. And with the COVID coming and the second wave of COVID predicted in the fall, she doesn't want to be part of it as far as a workforce. So there are a lot of things you hear from others, or the people who really see the survey, which we never think of it. So the whole purpose, as I was saying again, was to really address some of these questions, as well as to include them and give them the answer, saying that we are not going to do any of those things. We just want the numbers and the impact we're making, the contributions we are making. So it's only a very minority, but it is significant to really hear that kind of an answer or a question coming from them.
Thank you, Sarah. I think young nurses won't realize, these kind of questions will come up, their fear of coming back to workforce when they don't want to, and they're enjoying in their retirement. That is understandable. I know 30, 40 years, Indian nurses has been working in the United States, and we don't know how many of them worked or how many of them are working. So this is the right time. I also feel, there's many numbers have increased so far. So the next question which came up is, how is the identity of the participants are protected in this survey?
I think I can help answer that important question, important concern we have. The question is whether the survey protects my identity. It sure does. It sure does. The name of the persons taking the survey and the email ID, that have been made optional. So the initial plan was to keep it in the survey to make sure there was no duplicate entries. But then, however, we have decided to make that an optional item. So, and also the answers to these questions will not be analyzed. So the report will only provide numbers and percentages and not the names.
Thank you, Hari. Thank you, Hari, for your answer. It's wonderful. The next question that we have received is, once the survey is closed on June 10th, will you share the result of the survey? And how will you do that if you share that results?
I'm very happy to answer that question. Definitely. Definitely, we can let you know the result of the survey if you provide your email address. Although we have the cutoff date, June 10th, we might extend. So please try to do the survey and help us out in getting this total number of nurses who are in this country serving the people.
Thank you, Mary. Excellent question. The next question that we have received is, in the survey, it was asking about the basic nursing education. Can you please explain what does that mean by basic nursing education?
That's a good question, and I'm going to take a stab at it to see if I can help answer the question. So nursing is a profession that has to be licensed. We all know that. So we could get licensed as an LPN or an LVN. In California, we call LPNs, licensed practical nurses, as licensed vocational nurses in California. So that's the first level of practice as a licensed nurse. The second one is an RN, is a licensed nursing. And then we have advanced practice registered nurses, or we also call as APPs. So when you decide to practice in any one of these areas, the licensing board of the United States Board of Nursing prescribes a certain curriculum that you need to pass in order to be considered a person authorized to take the licensing exam. So whatever your course is, the basic educational course that you must pass before you can be called a licensed LPN, a licensed RN, or a licensed APRN is the meaning of basic nursing education. So let me give you a little explanation. In India, we have diploma nurses, we have ANMs, but of course, we don't recognize ANMs in the United States. And then we have the baccalaureate prepared nurses or BSN nurses. That is basic nursing education. If you advance towards masters, that's not what we are asking for. We are asking for your basic nursing education. Where did you complete it? Are you an internationally educated nurse? And if you're from Indian background, that's what we're counting you. I hope I've helped answer the question.
Thank you, Agnes. In the survey, there's an area to mention the national certification. Some of the nurses have a confusion about, what are certain national certification they should mention in the survey. So could any of you provide some examples of national certifications?
I think I can give an input into this question. So national certifications, they show your commitment to the profession and the desire to improve your knowledge and the skill, especially in a specialty area. So national specialty organizations and ANCC, ANP, and ASCN, all these organizations make nurses take additional exam, some additional clinical hours, and they provide this certification. Certification is a matter of pride for nurses, so we wanted to count that. So the certifications like RNBC, CCRN, and different nurse practitioner certifications, and PCCN. There is certification for the OR nurses and the emergency department nurses. In brief, all the specialty have a certification. That's what we are requesting in the information right here.
Thank you, Lata.
Thank you.
Can I add on to that one aspect of that certification? The most important message you're trying to convey through that, all that ABCD letters behind your name is you are a competent certified nurse in that field. So when you see that certification, it gives you a higher degree of competence and excellence in your practice.
Thank you, Sarah. There is another question that came from the audience is, someone is working 2 different jobs. Which one will I mark in the survey? And how will I answer the question in survey about the primary and secondary jobs?
Oh, I think I can kind of like give some ideas right there. So primary and secondary job, it's up to you which one you want to count as primary or which one as secondary. So the job where you are giving more hours of your time must be the primary in one aspect. Or if you love the other job, maybe you can count it as the primary. Of course, why the purpose behind this question is to find out which all ways the Indian nurses are providing to the American healthcare system. It could be a bedside nurse working at the bedside and maybe working part-time as a case manager, or a faculty and a nurse practitioner, or any combination. I think I answered the question.
Thank you, Lata.
Yeah, thank you, Leda. There's another question came through. As you all know, there are a lot of young nurses who are born and brought up in USA. Are they considered as Asian Indian nurses? Should they be taking this survey?
Yes, I can give you the answer, what I give to my children when they come and ask, Mom, I'm an American, and can I just say American? You know, I said, when we say race, you know, what race are you from? You really are looking at the origin of your race, where you came from. So we, as whether you're born here and holding an American citizenship or born as a citizen, as a youngster, your origin is still from India. So your parents, your grandparents are Indian origin. So the answer is yes, definitely. That's why we really specify Indian origin and heritage as part of our inclusion of nurses of Indian origin.
Thank you, Sarah. That is an excellent answer. We are still inviting any questions. If you have, you may place it in the chat or lift your hand so you can speak.
I think there is somebody who joined in our webinar. Her name is Prasanna. Can you open up for her to ask the question, Suja?
Trying to open up the question.
I think she wanted to ask.
Prasanna, can you put it in the chat? Somehow I'm having some trouble with this.
She has put it in the chat.
Yeah.
Okay, so I can, since we can't connect to her easily, let me ask you guys the question. How can we motivate the nurses to do this survey? The great question. That's all we wanted to hear.
That's what we want to hear from you all.
Yes, so it's a great question. And I think that is the crux of the matter, isn't it? We are not getting as much participation from our nursing fraternity today. So let me share that with you. And we all know Prasanna. Prasanna is one of our presidents of one of our chapters. So thank you, Prasanna, for joining this webinar. We so appreciate you coming on. So Prasanna is a leader in the chapter there. So she's wondering how she can motivate her nurses to participate in the survey. Let me share with you the data so far. As of this morning, unless someone can tell me the most recent data, as of this morning, we had about 795 participants for the survey. And we think we should raise it to tenfold, because we certainly know that there are at least 10,000 nurses of Indian origin in this country. So the power of motivation, in my opinion, is, I think most of us human beings, we like to ask a question when we are confronted with this, should I or should I not? We often ask our question, what is in it for me? So the answer for what is in it for me for the survey is, why do you feel proud about being an Indian? Why do you feel proud about being a nurse? And how can we collectively make the Indian community of nurses look strong, united, making a difference? And each one in that fraternity of Indian nurses matters. So every drop makes an ocean, right? So if everyone decides that we want to make a difference, to get this survey done so we know exactly how many Indian nurses are there, only then we can do it. We can't do externally any motivation. We do not have an incentive to pay you or reward you for participating in the survey. We believe that you have the instinct and the feeling that you want to be able to participate. So my answer to the leaders of NINA is, can you please ask Indian nurses, who are of course members of NINA, to participate in the survey, because we have about 1,700 of registered active members of NINA. If everyone participates, we have 1,700, and every nurse, every one of the 1,700 knows at least 5 others who are not members, or maybe more. So we can increase it to about 1,700 times 5. That is, I think, 8,500. We can easily do that.
We do. Thank you, Agnes, for all the motivation that you're giving. You're such an awesome speaker as well as, leader. A few questions we are getting through Facebook. Solimol Kurivila, I always admire her. She's one of our strong leader in NINA. She's asking, can we do the survey for someone else if they prefer to do so? And how can we get their permission, of course? Or with their permission, but can we do the survey for someone who doesn't want to go into the computer and do it? Can we do it for someone?
I'm happy to take that question.
Yes,
so
go ahead.
Here's what I think. We have not prescribed that the survey has to be done only by an individual. Many a times in many of the elections and other processes which are legal and official and formal, allow you to have a person to do the survey on your behalf. So much like that, someone else can fill the survey for another person. But the question here is, do you have the authorization from the person who's requesting that someone else fill the survey on their behalf? And as long as there is that agreement between the two, I think as administrators of the survey, we should be all right. What do you think, task force?
Agnes, I had been doing that actually for some of the retired nurses who really didn't want to go in the computer and do it. Mm-hmm. So what I have done is I have copied it, the survey tool in a paper, and then filled their answers, and then I say that I am the one who completing, and their initials will be there, and then that will be sent to Suja to be included in the main account. Main count.
Yeah, I think that is one of the perfect way for us to collect others' information, that we are getting the permission to do it and in a written format, so we can save it for our reference too.
Can I answer one question what Prasanna has asked about how to motivate additional to what Agnes said? I just want to use an analogy. When you are stranded in a place and you see 10 people around you, all strangers, and you see a person who is looking like you, who do you go to talk to first? Person who looks like you, right? Mm-hmm. So if every nurse who is in this country think like that, you want to be counted with this unique group of nurses who are called as Indian nurses, Asian Indian nurses, then you really do want to fill that form. So if you can just somehow each one of us think that way and communicate that to we want to include you in our group. So maybe that will work a little bit better. I don't know.
Thank you, Sarah and Agnes, for that great answer. The next question is from Alfie Rahman. She's asking, do we break down the survey by state? That was one of the questions in the survey.
Does anyone want to take the question? If not, I'll be happy to answer. Actually, Alfie, thank you for that question. That question is leading us to look at how we're going to analyze the data. And it makes complete sense. The purpose is to find out where our Indian nurses are and Indian advanced practice providers are. So obviously, we need to look at doing the analysis by state. So we are hoping to get to that place. And
Thank you, Agnes. Excellent. The next question is from Bina Valiakulam. She's asking about how are we reaching out to the nurses where there are no Indian Nurses Association? That's a very good question. Who would like to take a stab at this?
So I think I can answer that question. So this is one way we are trying to reach the nurses where there are no nurses associations. We had been approaching all the alumni associations. We were requesting friends and families to reach out and spread our message. Then we have approached some cultural organizations. They have not done much work, but they all agree with the need and they promise their support. So unofficially, they are spreading the news about the survey. And we are in the social media as well as the entertainment media. So the message is going. Some churches and priests, we are trying to reach out so we can approach the parishioners in that way. And I know Ms. Sarah Gabriel has shared it with the whole church community of her congregation. And so this is how we are reaching nurses of Indian origin through all these forums.
Can I just add a sentence to that, please? Quickly. Bina, thank you so much for that question. I'm so happy to see that you're attending this webinar. Bina, we are counting on you. Can you help us, Bina, to make sure that you will reach out to all your contacts? And I know you are a very, very influential person, and you are one of the notable leaders in the Indian community. So please help us, Bina.
She's probably saying yes. I haven't noticed her.
I'm confident she will.
She will definitely. We have so far, we have reached, all the questions, I think, right, Suja?
Yes. I don't see any more questions at this time.
I have a follow-up answer to that, to Bina. Even though NINA is doing this survey, this is not really for our members. It is for all nurses, and the members of NINA only maybe 1/10 of our whole nursing population here. So that means there's a whole slew of nurses outside of NINA membership. So we really, really want everybody's help to identify and spread the word and get the nurses who are not part of our membership. That's why it's not a membership drive at all. They just want us to count all our nurses and make them part of Indian nurses. So that is very important. And we do need, like Agnes saying, we do desperately need everybody's help. So I don't think in this, our Indian community, or I should say about 80% of the Indian community, there is a nurse somewhere there in their family. Don't tell me you don't have a nurse. You do have a nurse in the family. And then a lot of our community built from that one nurse who came in this country. So please include them, spread the word, and give their answer, numbers to us.
And also, I wanted to add for the listeners who are listening, this is not unusual, any organization taking a leave to do the survey. Because, as I know, there's Nurse Practitioners Association, they do more often surveys to find out where are their APNs located, or their work changes every year. There might be change of positions, change of work. So they wanted to know the APN community, how they're doing as an association from APN standpoint. So I think as a national Indian organization, regardless of our membership, we have, we have to find out, how many Indian nurses are helping United States, healthcare, basically.
To the moderators, with your permission, can I just add one sentence to piggyback on what Sarah and Simi just added? This is a survey by the Indian nurses, for the Indian nurses, not only of this generation, but for the future. So please help us.
And Agnes, there's one more question here from Bobby Varghese. Some of our retired and active nurses are connected to local and cultural associations. Are we planning for a phase 2 of the survey to include local association leaders?
Okay. I think I can take a stab at this question, and I'm hoping, Bobby, I can answer you as to what you're expecting. Otherwise, please clarify for us and also any other member. The purpose of our survey is to find out, and everyone knows, to find out about Indian nurses and how much of the contribution they're making to US healthcare. And cultural organization, social organization are part of the diaspora of any community. And they do make a difference. We want to be able to get the help of the cultural organizations and reach out to them to be able to help us. But we also want to retain our identity as a professional organization. So the help that we will seek from them is in the cultural organization. A lot of the Indian nurses are there. We know that because we do attend functions of the cultural organization. We would love to reach out to every one of the cultural organization, be it from Southern India, Northern India, Western or Eastern India, or any particular state or any particular denomination or religious affiliation. We want everyone to do that. But the phase 2 of the survey, I wasn't very clear on that. Bobby, could you help me, please? Does anybody else in the panel who would want to share your thoughts on that? Are we planning for a phase 2 of the survey to include local association leaders?
Oh,
And he mentioned in there actually today he was able to represent NINA to make a humble plea to our community members to be part of this survey at the Zoom event with Kerala Chief Minister after the first deadline. So, Bobby, are you there? All right. So I think this is something we can discuss in our NINA GB, and also we'll be able to get back to you in detail about that particular phase 2 of the survey to include local association leaders.
We are actually reaching out to all the religion-wise different leadership, like for Muslims and Hindu association, their national association. So we do have contacts. They haven't taken the word to a like a different platform yet, but we do have a contact, and we have sent emails to them. So that's something that we are working along. So if anybody have any opinions about how we should do, they are more than welcome to contact any of our panels or our Dr. Agnes.
Also, if I may just add, oh, I know, Sarah, you want to ask a question. Go ahead, Sarah.
I just want to add what Simi was telling. It's not just the Kerala associations or cultural organizations. We are trying to reach all ethnic other states, like all our Indian states, people who have organizations, who have news outlets. So we are trying to reach all of them the very best way we can possibly do, like Hindi, Malayalam, other languages. So we're doing that.
Thank you, Sarah. Agnes, go ahead.
I was wanting to say this, I think I lost my train of thought, but what I was going to say is our purpose is basically to reach out to every nurse and find answers or find participation. Our task force, as you can see, is a small one. If there are more volunteers who can help us join and take the effort to take some responsibility and or spend some time to reach out to different nurses in different states, we would welcome that.
Thank you, Agnes. Simi, go ahead.
I think we can conclude our meeting since we have completed all our question answer session, and I don't see anything else coming through our FB Live or in the Zoom webinar. Let me welcome the president of NINA to say a few words before we wrap up.
As I said, I'm going to probably repeat myself by saying this is a survey of nurses, of Indian nurses, by Indian nurses, for Indian nurses. So unless we get everyone to join this mission, we may not be able to accomplish, but we are not people who give up. The very fact that we left our country miles and miles away to come here shows our commitment and dedication to goals. And we are very goal-oriented people. And a lot of what happens to Indian nurses for advocacy, for policy, for planning, these may all rest on the fact that we can represent a group solidly to wherever we need to represent. My thought process is, which I'm echoing on behalf of the task force and the GB of NINA, is that this is the time for us to be able to do this, because this is the time when the reputation and the recognition and the worth and value of a nurse is at its peak. And we may be able to make a huge contribution or make an impact to say how much of a difference we're making, but unless we get the numbers, we cannot talk. We may not be able to be effective in raising our voices. So again, at the end of this session, which I think our moderators and the panelists, we all try to do what we could do to appeal to everyone. We would like for you to join us. We would like for you to spare a little of your time, a little bit of your time, to help in this worthy cause, and our future generations will be grateful.
Thank you, Agnes. I also wanted to mention something which Agnes knows. I know we did not discuss it here. This idea of the survey, it did not happen all of a sudden. It was requested by United States officials asking us, I know we forgot about this, right, Agnes?
Yes.
United States officials asked one of us whether we have a number or not. We couldn't say any answer to them. They wanted to know how many Indian nurses working in the United States. Just a ballpoint number they asked, but that also we couldn't give because NINA had only very limited membership. So this is the idea which we made as a task force and started. So we started, you know, we are throwing it out there, how much ever we can, and anybody can join this to get as much as nurses to take survey, and we need an close to accurate results from this survey. So I take this opportunity to thank NINA Task Force for answering all questions regarding Asian Indian Nurses Survey of North America. I also thank the audience who joined us through the Facebook Live. I hope the panel answered all your questions regarding the importance of this survey among Indian nurses. I also wanted to conclude with a quote: "Alone, we can do so little. Together, we can do so much. So let us come together and be counted."
Simi,
yes, Agnes.
Just to give you some hope here, to give everyone a hope, a question came across our chat, and that is from a nurse who says, she's a nurse, I'm sure. Yeah, I know her. She says, "I was not able to join this webinar earlier. I am more than happy to assist you all in this survey. Please sign me up."
Very good.
Thank you, Ingrid D'Souza. Yeah. Thank you, Agnes, for bringing that up. And thanks to everyone who have completed this survey. Those who have not, please take a few minutes to complete this survey. And it only takes less than 4 minutes to do this. And we appreciate your time, interest, and support for this endeavor. Any questions, please email ninanewsusa@gmail.com or call 1-8861-NAINA or 1-88-616-2462. Thank you. Stay safe and well. Have a good night. Bye.